In the realm of healthcare, clinical summarization and patient chart review are pivotal for effective delivery. However, managing unstructured patient data in electronic health records, EHRs, poses a significant challenge to clinicians. Accurate summarization is crucial for precise diagnosis, efficient patient care, and improved patient outcomes. Clinicians employ diverse approaches to clinical summarization, with varying degrees of importance placed on this process. The use of tools that streamline clinical summarization is a topic of ongoing debate, raising concerns about data privacy, ethical considerations, and workflow disruptions. The advent of generative artificial intelligence, AI, is transforming clinical summarization. It has the potential to reduce administrative burdens, enhance patient-centered care, and unlock clinicians' potential. Despite ongoing debates and concerns, AI-powered clinical summarization tools represent an exciting frontier in healthcare. This review aims to provide an overview of recent literature and case studies on the impact of patient chart review on communications, diagnostics, and management, as well as recent efforts to integrate AI into clinical summarization tasks. The current state of clinical summarization in healthcare and how AI is pushing its boundaries are explored in depth. Patient chart review is a critical component of clinical workflow, involving the manual clinical summarization of unstructured patient health data stored in electronic health records, EHRs. This process allows physicians to gain contextual information about the patient, which is essential for effective patient communication and avoiding misdiagnosis or contraindicatory management plans. The value of EHR data has led to efforts in implementing natural language processing of clinical narratives into diagnostics, such as managing coronary artery disease and depression. For patients with chronic conditions, clinical free text is considered more valuable than structured data like ICD-10 codes, which are often plagued with errors or misdiagnoses. Literature on EHR has shown that low-quality medical data management and usage are key reasons for medical errors. A case study demonstrated that unstructured clinical narrative information contained in EHRs is sufficient for conclusions about patients' pathophysiological processes and therapeutic advances, even for up to 94.9% of cases. However, thorough patient chart reviews can take up to 30 minutes per patient case, and despite this time investment, diagnostic and management decisions are not perfect. An independent second round of patient chart review found that 36.6% of the cases had to be corrected in either the pathophysiological process identification or therapy management decisions, highlighting the imperfection of even the most thorough patient chart review process. Most physicians in the United States do not take sufficient time to conduct patient chart review, with a survey of 155,000 U.S. physicians in ambulatory subspecialties or primary care utilizing only 5 minutes and 22 seconds per patient encounter. This poorer quality of the average patient chart review leads to larger quantities of misdiagnosis and thus, medical errors, malpractice. There are many medical error scenarios associated with patient chart review, such as iatrogenic adverse drug events, AID, caused by inconsistencies in a clinician's knowledge on patient allergies to medications. Case studies have shown that many of these AIDs involve insufficient knowledge on the side of a clinician due to incomplete record review and internal inconsistencies found in the unstructured data within health records. Another study highlights this lack of clinician knowledge despite sufficiently documented patient information, having caused 29% of the study's preventable AIDs. Patient chart review is also key in transition of care, as patients being transferred between clinicians require fluid and comprehensive communication of all relevant patient health history to prevent confusion, poor management, and ultimately malpractice or negligence. An average large academic teaching hospital can have up to 4,000 transitions per day, and this high volume of transition is a rich breeding ground for medical errors due to lack of comprehensive patient information and thus, a poor understanding of a patient's status. A 2016 study showed that 30% of malpractice claims in the U.S. were attributed to poor communication between clinicians, resulting in 1,744 deaths and $1.7 billion in claims. Physician burnout and information overload are pervasive issues in healthcare, with electronic health records, EHRs, being a significant contributor. The sheer volume of patient records, often exceeding 500 pages, necessitates an average of 1.5 hours per day spent on patient chart review, leading to medical errors and delayed patient care. In fact, 29% of errors in one family medicine case study were attributed to patient information processing. Moreover, 69.6% of primary care physicians receive more information than they can handle, resulting in missed test results and delayed care. This information burden not only affects physicians' time but also contributes to burnout, with 50% of primary care physicians experiencing burnout, citing EHR workflow as the main contributor. The correlation between burnout and EHR workflow is substantial, with physicians spending 49.2% of their time on EHRs and only 27% on face-to-face patient interaction. To address this crisis, artificial intelligence, AI, is being increasingly incorporated into clinical summarization. Natural language processing, NLP, and large language models, LLMs, can process vast amounts of information to determine illnesses or patient information from clinical free text. Companies like Sporo Health are innovating AI agents to combat issues in clinical summarization, ensuring accuracy, personalization, privacy, and high knowledge floors. Case studies have verified the effectiveness of AI in various clinical settings, aiding in chart review and summarization of clinical information. The role of AI in clinical summarization is crucial in mitigating the information overload crisis, reducing physician burnout, and improving patient care. The role of artificial intelligence in summarizing radiological case reports and biomedical research is a topic of significant interest. A case study demonstrates the capabilities of NLP summarization models, such as BART-CNN and GPT-3 DaVinci, in enhancing readability and comprehensiveness while reducing text length to less than 20% of the original case reports. Notably, these models were not trained on any clinical dataset, suggesting potential for their use in enhancing clinical workflow in fast-paced settings. Large language models, as evaluated in a recent study published in Nature Medicine, have also shown superior performance, even surpassing physician evaluations. This has significant implications for reducing medical errors associated with patient chart review. The SPEC framework is another methodology discussed, aiming to address variability in AI outputs by employing soft prompts, enhancing stability and consistency of AI-generated summaries. Comprehensive datasets, such as the MIMIC series, are crucial for training and refining AI models for tasks like disease detection and report generation. The paper discusses the challenges and future directions in AI-driven clinical summarization, focusing on privacy concerns, data quality, and system integration. It emphasizes the transformative potential of AI for healthcare, promising to enhance efficiency and accuracy in medical documentation and decision-making. However, substantial challenges need to be addressed, including data management, system integration, and maintaining ethical standards of patient care. Privacy concerns are paramount, as AI systems must ensure the security of patient data and compliance with healthcare regulations such as HIPAA in the US. The accuracy of AI-generated summaries is heavily dependent on the quality of the input data, and errors in initial data or poorly calibrated AI models can lead to incorrect summaries, negatively affecting patient care. Integrating AI tools into existing healthcare IT systems poses significant technical and operational challenges. Compatibility with diverse systems, user training, and the adaptation of clinical workflows are essential factors that must be addressed to achieve seamless integration and utilization. Future developments in this field will likely explore more sophisticated models that can handle a wider range of data types and clinical scenarios. Additionally, the ethical implications of AI in healthcare, such as racial or socioeconomic bias in AI algorithms and the impact of automation on employment within the healthcare sector, will need to be carefully considered. This section of the research paper delves into the challenges and limitations associated with the use of electronic health records, EHRs, in healthcare settings. Key issues include inadequate handoff communication, information overload, and the potential for errors due to the complexity and volume of data contained within EHRs. Studies have demonstrated the negative impacts of these issues on patient care and healthcare provider well-being. Inadequate handoff communication has been identified as a significant risk factor for adverse events in healthcare settings. 10. Information overload can lead to burnout among healthcare providers, particularly when they are required to spend extensive amounts of time navigating complex EHR systems. 15-16. Furthermore, the paper discusses the potential for errors in EHRs, which can arise from a variety of sources, including inadequate training, system design flaws, and the sheer volume of data contained within these systems. 17-18. The authors also note that efforts to address these challenges through the development of automatic text summarization tools for biomedical literature and EHRs have shown promise. But further research is needed to fully understand the potential benefits and limitations of these technologies. 19, 20, 21, 22, 23, 24.